Hi, everybody. Welcome to Wednesday webinars. This is Julie Lundberg from Triarch Health, and today we are going to talk about Pdmp and the opioid crisis. We're going to hope that the slide deck will move for us. It always wants to give me a little trouble. There we go. So Pdmp and the opioid crisis. So what are we going to talk about today? We'll define Pdmp for you. We'll talk about how the prescription monitoring programs work. We are going to educate you about the fact this is controlled at the state level. We'll talk about the two different kinds of reports you can get, the Pmp Gateway, sort of basic report versus the Narc Score. We'll also review the two solutions that we have available through our EHR integration with Dr. First. And today we're really more focused on the Appriss EHR integration. We'll show you how it's embedded within your Triarch QEMR workflow. We'll give you a little insight into what the Narc Score is all about and help you understand who's able to access Narc Score reports through the EHR integration. We'll also talk a little bit about Pmp Interconnect, which is the interstate exchange. And then we'll sum up with how do you go about onboarding with Appriss. All right, so sorry, this is a busy screen, and you know I always love to give you content you can review later, so there's a lot of detail here. So we keep hearing Pdmp and Pmp. It's really prescription drug monitoring programs, and sometimes they just drop the word drug and just call it prescription monitoring programs. They're talking about the same thing. And what are these? They're statewide electronic databases that track the prescribing and dispensing of controlled substances, including patients who might be seeking prescriptions from multiple doctors, those guys that are considered to be doctor shopping. Pdmps are designed to help authorities monitor for suspected abuse or diversion, right? So I go get it filled, but I don't take it, I sell it to somebody else. So diversion of prescription medications, including opioid analgesics, and can help healthcare professionals identify patients who may be at risk for drug misuse or addiction and could benefit from early intervention. So how do the programs work? They are state-based electronic databases that provide a way to track prescriptions, specifically controlled substances, including opioids, benzodiazepines, and amphetamines. They are intended to support access to legitimate medical use of these drugs and to help identify and deter drug misuse and diversions. So diversion, when medications are not used by the person for whom they were prescribed. Currently, 49 states, the District of Columbia, and Guam have PMPs, and in many states, the providers are required to access the PMP before prescribing a controlled substance. PMPs have had some success with several states demonstrating an overall decrease in prescription opioid overdose after implementation. At the same time, there are several challenges hindering effective use of prescription monitoring programs, including issues of lag time, state-to-state variability, and important privacy concerns. These issues need to be addressed as this tool is used more and more frequently. So we're all, as we're rolling this out to customers, you guys are coming to us with your fantastic questions, and I'm going to try and address as many of those as I can during the course of the webinar, and then of course you send us questions and we will respond to those afterward. Okay, so all states have established PMPs. Most use Appriss Aware RX, I think is kind of how they call it. And this is an important thing to understand. As we made the decision to move to a direct integration with Appriss, it kind of felt like, let's go straight to the horse's mouth. This is the technology in use at the state level. Let's connect to them directly instead of through a third party, which was what our original integration was through Dr. First. So anyway, yes, most states are asking you, they've established the PMPs and they are wanting the providers to access this. Some of the states even fund this EHR integration, which is really cool, and we'll dive into this a little deeper, but it's very specific state by state. It's changing constantly. Here in Michigan, up through August 31st of 2019, they were funding. Now they're not, right? That they hit that cutoff. At least I can't find anything that indicates if they have extended that deadline. The pricing, and this is not anything that we charge, there's no charge for the EHR integration from our side, but Appriss does charge a fee. And for the straight PMP report, which is called that Gateway Integration Basic Report, which I have a little screenshot there, which basically it shows you what you're trying to prescribe today, the summary. So in terms of summary, total prescriptions, total providers, total pharmacies. There's a lot of information gathered from that knowledge. Is your patient going to multiple providers and multiple prescriptions for controlled substances and from multiple pharmacies? And then like a red flag goes off if there's high numbers there. And then there's detail under each of those sections: prescriptions, providers, and pharmacies. So that's the basic report, and that is $50 per provider per year. The Narcs Care report is more, they call that the advanced analytics, and they're using this very interesting algorithm to come up with the risk score for that particular patient. And that is an additional $250. I have 300 here, and I've learned that the 300 actually covers Narcs Care and PMP. If for some strange reason you just went for Narcs Care, it would be just $250. So that's how the funding, and it's crazy when you see how the states fund or don't fund, and which sometimes they'll fund the Gateway report, not Narcs Care. Other times they'll cover Narcs Care and not Gateway. It's a little confusing, to say the least. I also thought it was interesting, the takeaway from this, don't try to study this. The takeaway from this slide is it's controlled at the state level. Every state has a different requirement. So be aware of the requirements in your state, and that's sort of the message here. They're all just a little bit different. And then this is a spreadsheet that we have access to from the Appriss website that kind of gives us the latest and greatest, what's going on with each of the states. And you can see how many different rows, columns of data are here, right? All the different moving parts. What I'm usually looking at is, have they approved the EHR integration? So that's what we're talking about today. This is embedded within your EHR workflow, which is different from what you're probably already doing, which is just logging directly into the state Pdmp. So we're talking about today the integration. So which states have approved integration? Are they live? Are they funding the integration? Are they funding Narcs Care? And then it just goes on and on and on. So every state is different. And again, it's changing constantly. So MIPS, part of promoting interoperability in 2019, I wanted to make sure everybody understood. So the query of the MIPS of the Pdmp from within your EHR, so this, what we're talking about today, you got to have the EHR integration to get these bonus points in 2019. They could not have made this any easier for us. It's one patient. So for one patient, did you query the Pdmp from within your EHR? Did you have EHR integration to query the Pdmp? And we'll demonstrate what that workflow looks like. And that's what this is all about today. How do you get there? How do you get integrated from QEMR to Appriss? So 5 bonus points. Just as a little side note, next year it will no longer be bonus points, but I think it's still 5. And you'll notice underneath that the Verify Opioid Treatment Agreement, which is 5 bonus points this year. The proposed rule, which has still not been finalized for 2020, is recommending the complete removal of the Verify Opioid Treatment Agreement, which as a product manager, that makes me very unhappy because we invested some effort in building that nice tool. So yeah, that was a waste of time, but I hope people will still use it. Okay, so this is really the meat of the presentation, the Triarch in Workflow Pdmp Access, also called EHR integration. When we're poking around on the different Pdmp sites at the various states, it seems like EHR integration are sort of the keywords that help folks understand what we're trying to achieve here. This isn't about registering authorization to access the PDMP outside of the system. This is all about EHR integration. Okay, so we've been doing this for a while. Our original approach to the in-workflow access was through our EPCS partner, Dr. First. I've got some friends in Michigan on the line today who would let you know this was not a good solution. It came too late in the workflow. You had to have already made the decision to prescribe the controlled substance before you got to the screen that showed you this feedback. Not our favorite way to do this. Really, you want to see that, you want to get this feedback before you're making the decision to prescribe. So we listened to our frustrated customers and decided we needed to go a different route. So we integrated directly to Appriss, so Appriss, direct integration, the better solution. And our two, so the two reports available through the direct integration are the Pmp Gateway, which is the basic report, and then the Narcs Care. That was another drawback from the Dr. First solution, was the Narcs Care report was not yet available. That may have changed, but in the beginning it was not available. Okay, so what does it look like? So those of you who prescribe medications through our system will recognize this screen when you first pull up the RX Med screen, right? You've got the patient's banner the patient banner at the top, and then the new prescription section, and right now it's highlighted on medication history and showing me the meds the patient's already on. I have that very annoying allergies bar that's right in my face by design. I know it's annoying, but it's got to be there in your face. And then right underneath that, we're showing the Narc score it's already there. It's because we're sending a file out that, you know, we know who's coming in the door today, so we've sent a file out, and so these are sitting here waiting for us to review. Then there is, so these are the Narc scores, and then you just see that little blue hyperlink to Pmp Report. That's the link to, and I explain it better here, that is the link to the other report, which we're going to have a little bit of a blow up of it. So the Pmp report, that was the one that's, oh, here's the number, here's all the pharmacies, the providers, and the prescriptions that we're thinking about regarding this particular patient. So that link lives right here. So you would click on it as the prescriber, and we're going to talk about this in greater depth. Only prescribing users, only prescriber users have access to this, and that is not a decision we were able to make. It was something mandated, so we'll talk about that in a second. So if you're a non-prescriber user and you log in, you're going to see zeros here in the Narc score, and you will not be able to access the Pmp report. But the providers can do it. The prescribing providers can do that. This is the report. So it's showing that detailed information we keep talking about, right? The total prescriptions, total prescribers, total pharmacies in a summary level, and then the detail below. We've also, so this is a screenshot of, I'm in looking at, so this is what it's going to look like when I am looking at the report. And there's all, it's a very robust and kind of a dynamic screen. You can get in here and review multiple different tabs. It's giving you obviously the patient's name at the top, the Narcs report. You can click send to DMS and it will automatically file this into the patient's scan docs. So we watched our folks using the Pdmp where they were logging in separately to that website, and what were folks doing with those reports while they were printing them and scanning them into the DMS. So we put this nice handy little button in here that will just send it to the DMS for you. It's also actually filing them to another section of the patient record called Pdmp programs. So there's kind of two places where you can access this information. We went with the scan docs route because it seemed like that's where folks were getting most used to looking for it, but there will be two places in your chart where you can review it. This is all, how do you go about setting it up? Nobody needs to really pay a whole lot of attention to this. This is what we do this for you. It's a service level regarding your prescribing rights, and there are usernames and passwords that are given to us by Appriss directly for the EHR integration. We've had folks say to us, well, I already have a username and password. Can't you just use that? Well, that's for your login to your state-specific PDMP. It's not to enable this connection between our EMR and Appriss. So FYI, that's why there was some confusion in the early days. I already have a username and password. Why do I need to go through all these steps with you? And then this is just, again, enabling the report download in our system, telling the system where we're going to put it. So we've had a couple people say to us, so these Narc scores, they sound really interesting and exciting, but what are they? Well, this is something I have never heard of. So there is a lot of information. If you go hit the Google, you'll stumble across all kinds of stuff. We can, we're going to circulate this this PowerPoint so you can review it from here. I think it would be irresponsible of me to try and give the clinical education. I think that's something the providers need to do. There is this explanation. There's a link to this particular document. From what I'm seeing, most PMPs at the state level are providing this very Appriss Narcs care document to their constituents, their providers in their state. So this is just a little glimpse into the algorithm and what do the scores mean. There's also, here in Michigan, I've listened to this recording video where they take you through the whole thing. I think it's really, they do a nice job. I highly recommend this. So this is published by Appriss, but on the MAPS PDMP. MAPS is our Michigan PDMP. So there's a link to this as well. And if you're a visual learner and you like to have someone talk, you like to learn through your ears, you want someone to talk to you about it, this would be another great resource to learn what the Narcs score is really all about. Okay. We touched on this a minute ago, and I said to you, hey, the Pmp report via your EHR integration, so we're doing it from within QEMR, only prescribers are allowed, and everybody is up in arms and saying to us, that doesn't make any sense. My MAs and other folks in my office, my delegates, are able to access the Pmp report when we just log into the website. And all I can say to you is the states have been very specific about this. They're not really giving us the reasons why, but I will tell you, I've got a screenshot here. On the left is from Indiana and on the right is from Michigan, and I find it fascinating. They're using the exact same verbiage. They're going to great lengths to explain who has access, and they specifically are stating delegates, both unlicensed and licensed, are not able to access, inspect, or MAPS data via EHR integration. Instead, delegates will continue to access MAPS via the web application. If I had control over this, I'd try to help you out, but it's out of our hands, but I did want folks to understand where this ruling was coming from. All right. Several of you have asked the question, well, okay, I'm in Las Vegas and I have a lot of folks who show up here from California or another state. And, I need to know what's being prescribed for them in other states. So Appriss has solved that with what they call Pmp Interconnect. So there is a national network of state-based PMPs, and they are connected and communicating with each other. But you'll see that California and, what is that state underneath? My geography is really bad. Yeah, under South Dakota. What the heck is that? Anyway, there's another state that doesn't participate, and then there's spotty areas of Missouri that do. So just FYI, most states are communicating with each other. So the data is crossing state lines is the big message here. And there's a hyperlink, and you could go view all this and read up on it if you wanted to. So how do you, if you're interested, what are the steps? So we've been working with Appriss for many, many months. Gosh, could be up to a year by now. There is a very specific Triarch EHR integration request out on their website. And there is a hyperlink to our request form. We can send that out. I think you can find it out on their website. But regardless, you complete this, you fill this all out, and here they've defaulted in your EMR software vendor. It will only say Triarch if you click the link and go to the one that's for us. So you fill this out, and really this triggers the whole thing. Appriss gets this, and they do all sorts of things. They're like, oh, okay, are you a funded state or a non-funded state? Okay, well, if you're a funded state, there is no cost to you. And once you submit the request, you'll get an email response that will tell you to go to the state's website to complete the registration process. Once the state approves the submission, the state will notify Appriss. So that's if you're a funded state. Then if you're a non-funded state, you will have the license fee, which again is $50 per provider per year for the basic report, and then an additional $250 per year per provider for the Narcs care. And then here they're helping us understand from a workflow perspective, once the client submits the request form, they will receive an auto response directing them to the next steps of the integration process. So long story short, once you fill out the form on the Appriss website, they will guide you because they know who's funded and who's not. Then there's this whole concept of registering and provider registration and authorization. Many of you have already done this, right? You already have a username and password, and you log into your state PMP. You're registered with them. If you aren't doing that, most states will ask you to do that. Before they're going to grant you the EHR integration, they want you to have this as well. So just heads up, that's what this provider registration and authorization is about. It's not for the EHR integration. It only facilitates your access straight to their website, but it's something they want you to do before they give you the EHR integration. This was something we stumbled across because our awesome users come to us and say, here's my experience. Here's what I'm going through trying to get up and running with this. What is this? I've already filled out a form. What is this new form? So sure enough, this on the, let's see if I can orient myself, on the right-hand side, the maps that we see the login, right? This is what it looks like if I'm going to log into maps, Pdmp directly to Pmp Aware RX and maps in Michigan. This is what I'm doing that has nothing to do with the EHR integration, but it's where I've been going to get the data. Then if you want to do the EHR integration, so that's what this form is all about, there's a whole new form, and it's different. So we're trying to help folks understand that it feels like you're doing something you've already done before, but it is in fact different and new. So that's just a sample. Okay, so if you decide this is for you, what should you do next? Complete the Appriss Health Triarch EHR Integration Request form, which is found at this link. So and we can also, maybe we can shoot that out in a reminder, or the link to this webinar. Maybe we'll shoot that out to make it super easy. Again, you want to confirm that your providers have completed the Pmp Aware RX account creation. Again, this is independent of your EHR integration, but they want this to be done. And if you're already using your Pdmp, then you've already done this part. Follow the guidance that Appriss will send you, right? What are the next steps? I want to even say, one of my customers let me know there was, I think they have Appriss might have like a weekly onboarding webinar for folks who send them the EHR Integration Request form. I think there's a webinar. They kind of welcome you to the program and help you understand what next steps are. So that would be a good thing to attend. And then if you, let's see, what did I say? Complete the state request form, part of Appriss state guidance for funding state. So that is what we just looked at here, right? So this will, they'll guide you towards this, but if this is required, obviously that would be the last step. And that is it. That's everything you need to know about how to get up and running on Appriss for direct integration from within QEMR to that state PDMP. I'm going to spare you the services to bridge the gap. I think anybody who's attended our webinars, you've seen all that jazz. So please, if you've got questions, send them in. Sarah and I will work on responses and we'll send that out with the crowd. And I'm going to give you half an hour of your day back. Thank you for joining us, and we really do think this is an exciting new service, and we highly recommend it. All right, thanks everybody. Have a great rest of your day.